what are the pros and cons of choosing pathology as your specialty?
The pros, if any of the surgeon has a doubt, you might be able to help them. The biggest con is you are a director, you are not an actor, you are not in the front.
What kind of characters should a student have to actually be the best fit for pathology as their specialty?
The first thing I would say is the learning curve. Don't expect to master the subject within a year or two. You cannot.
What if tomorrow the corporate hospitalist does not recognize that fellowship? Does that 1 year completely go into waste?
Corporates don't even care about it.
What is the minimum capital required to open a lab?
The first and the foremost thing, if you want to open a lab, the mindset should be of a founder or an entrepreneur.
How much does an MD Pathology or a DNB Pathology can earn in our country? We are on a mission to build India's largest community of medicos. And how you can help me? First of all, yes, you have to subscribe the channel. And thank you so much, guys. Because of you, because of your support, I am able to get the best guest for our show. So thank you so much, everyone. We have tried a new concept this time that we are asking you questions about the specialty that is supposed to come in the next guest. And I have got tons of questions. So now we are able to, move in the right direction and ask the more relevant questions. So thank you so much, everyone, for that support. So in our today's show, we have a very special guest, a pathologist from Chennai and a pathologist from the prestigious college of JIPMER. Now he's a gold medalist himself. He is a specialist in oncopathology and molecular pathology. And I'm sure you must have guessed the name by now. He is Dr. Ranjith A R, a very dear friend, a mentor to I don't know how many students, and an entrepreneur himself. And I'll tell you a little bit secret. He was one of the first content creators who started with me back in Bhatia in 2015. Because of him, we could actually make the DBMCR Premier Group, which today, teaches almost 50,000 students yearly. So he has been a dear friend for the last 10 years now. He's a teacher. He has been an educator for almost 15 years. So a lot of knowledge, a lot of experience, and he has run a lab himself. So we are going to discover each secret about pathology, how much a pathologist can earn, how much does it take to start a pathology lab, when should an SR, a pathologist, basically think about starting a lab, what are the specialties possible after pathology, and the most relevant question, what is the future of pathology? So the whole pathology decoded with Dr. Ranjith. So let's welcome Dr. Ranjith. So happy that you are here. Welcome to the Nachiket Bhatia Show.
Thanks a lot, Dr. Nachiket. It's been a pleasure to be meeting you here. And hopefully we'll discuss more things which will open up multiple things, academic, non-academic, for pathologists and every MBBS students out there.
Absolutely. And thank you so much for taking out time. This conversation that we are going to have. So apart from the normal questions that I'm going to ask you, we are going to have a very special segment also.
Sure.
So we tried something new, and guys, thank you so much for the support, I would say. So basically we have opened that we are going to launch, we are going to interview a pathologist, and we asked the students to put their questions in the Instagram and YouTube section. And I have got tons of questions.
Sure.
So I think apart from my normal questions, those questions are the real gems for today's podcast.
Sure.
So before we move on to the pathology part, let's start with the beginning of Dr. Ranjith. How did you get into medicine, and why did you choose pathology as a specialty?
Okay, I would say I'm an accidental doctor. When I was in school days, I'm not a person who wants to become a doctor from 6th standard. I was a good student. Primarily that was it. I used to read well. And once I got a score in the 12th, I had an opportunity to go into both engineering as well as medical. So since both the scores were decently enough. So I had an uncle who is a doctor. He's the only doctor in my family. What brought me into choose medical rather than go to engineering is the amount of respect he has, be it within the family or outside the family. That's kind of attracting. Like, if someone outside the family who's not even related to you talks to you like, oh, he's your uncle. Okay, that is something which is very attractive for a young 12th standard student. So that's when I said, like, okay, I don't know primarily about anything about medicine when I joined medicine, as opposed to these days kids, they are like very, very well informed. So that's one reason I said, okay, let's take MBBS. Second, coming to your second question, why pathology? It's more of a personal connect for me for pathology. When I was in my second year of MBBS, I have told this in multiple places. My mom had a swelling. So for me, in a second year of MBBS, a swelling, you know what comes to your mind. Obviously, you Google also, the same thing comes to mind. Okay, I was like worried, okay, something bad is going to happen. And then when you look for whatever with the second year knowledge, the treatment, obviously it comes to a surgery. When it's in leg, it was very difficult options given there, which is very difficult for me. It destroyed my peace almost for a week. The surgeon took a biopsy and the biopsy turned out to be a normal thing. So that's when I decided, okay, I had a doctor who reported that, and also I took that to my college pathologist. She also said it's good. So for me, that report kind of saved my mom's leg. Whether it's true or not doesn't matter for me, because as I'm very close to my mother, like most of us are very, very close to our parents. For me, that changed the entire perspective of, okay, I have to do this because it saved my mom's leg. Whether it's true or not true, that's debatable. But for me, I think I had an kind of a life is a circle for me. So I completed pathology. Before doing SRship, the same lesion recurred for her. So that time I looked into and said, okay, it's not a cancer again. So it's been close to 20 years. Nothing has happened. It's not recurred again. It recurred once. And then we did the wide localization. That is one primary insight for me to get into pathology. It's not about the passion for subject. I'll be very honest about it, because as a second year MBBS student or even as an intern, you don't get much insight of what pathology has to do. Medicine, surgery, OG, pediatrics, yes, I'd have gone to the OPD, I'd have seen patients, but not much of an insight of pathology. It is totally a personal choice. It is because of that decision which changed, and my entire life trajectory also changed maybe after choosing pathology. That's my answer.
That's an awesome thing that you have just told. And I think the reason I got you for this podcast was that I think as a pathologist, you have done everything. You have worked as a pathologist, you're an educator,
True.
you have got your own lab as well. You have
True.
run that lab.
True.
You know, whatever, I can understand that how much effort it goes into setting up a lab, the capital, the infrastructure, and everything. So we're going to talk about detail in there. But before that, of course, you are an alumni of the prestigious JIPMER college. How's the JIPMER life?
JIPMER life outside academics, it's amazing. When it comes to academics, one biggest factor of, I think this will hold true for every central institute as opposed to a state medical colleges, the doctors there don't have a private practice. So the only thing they have is hospital and students. We used to get the knowledge, the experience unfiltered. They won't leave the hospital at 4 p.m. We had pathologists. You won't believe that my HOD comes to the lab at night 9 p.m. and report. I did my UG from a government medical college as well. I've not seen my pathology department open after 5. So the biggest advantage of a central institute, you get entire experience, entire knowledge. They are available whenever you want. So if you have the will to learn, that's a place. That's one biggest advantage. And second thing, like we used to have night duties as pathologists, primarily in hematology. If some leukemia or something comes, they start putting us to night duty after 6 months into pathology. So first time reporting a cancer in the middle of the night is difficult. Still, I remember my professor used to say, if it's a problem, take a photograph and send to me. I have pinged them at night 1 a.m. If they don't pick up the reply to us, we call them at night 1 a.m. And I don't think that liberty you get anywhere in the other outside. So a professor picking up a call at night 1 a.m. and saying, yes, it looks like a cancer report, and tomorrow morning I'll come and recheck it. That level of hand holding, that gives an amazing confidence. Okay, there is someone to back me up if I do an error. I feel at a young age of 23, 24, 25, you need this backup. That definitely JIPMER gave me, and I hope every central institute gives me, and quite a few other medical colleges also gives that. But I feel this is definitely more in a central institute compared to the government and private medical college, because the doctors have multiple roles there. Here, the doctor has only one role, being a doctor and being a teacher. That's one biggest advantage, I would say.
That's a beautiful, I would say, a journey about JIPMER. And since it's so prestigious, I'm sure there are plethora of reasons, but I think this is one of the main ones.
True.
So that's great. You are also a specialist in oncopathology and molecular pathology. The reason for choosing these subspecialties are?
I'll be very honest, I'm a bit lazy. Fine. So my PG thesis was on PCR and looking at mutations in acute myeloid leukemias and its prognosis. So when I used to diagnose leukemias using a bone marrow, it took, let's say, 15-20 minutes. I have to count them, I have to report them, I have to write the report. Doing a PCR is just switching on the machine. So my entire thesis of all the cases we had 80 cases, we pulled up every case, we stored them, and then we ran in batches. I can do 10 PCRs just pipetting. It'll take hardly 5 minutes. Put in the machine, switch on the machine, go outside, take out and put in the gel, 10 minutes. So I could diagnose it very easily. And the most advantage is, since it's machine based, the amount of errors is very, very less. That is one thing which has dragged me into molecular pathology. And I would say one seminar from a person who came from UK in one of the conferences, he said that this is something which can change the life. The way it changes life is, if let's say there's a young parent getting a genetic disease, there are technologies now. I can take the blood of a 10-week-old mother and can predict what will happen to the kid, not even touching the kid. 10-week pregnant mother, we can take it. So, and also using IVF, we can select embryos. So, if with technology and with advancements, we can actually do something miraculously good. That was given by the persons in the speaker in the conference. These both is something which primarily attracted me towards molecular pathology. And oncopathology is a part of molecular pathology because most of the molecular genetics which comes in our country is, as of now, is mostly cancer related. So I have to definitely diagnose that, confirm that, take a tissue from that, and then do a genetic test. So it's kind of an codependent branch, I would say, as of now at least.
That's great, boss. Now let's talk about pathology as a branch. If I simply ask you, what are the pros and cons of choosing pathology as your specialty for a student who has just crossed MBBS?
So, like I said in the start, we don't have much insight about what actually a pathologist does in a MBBS. We don't have internships also there. So primarily the idea will be, okay, they'll be teaching MBBS students and doing the practical assessment. That's not what actually a pathologist does. We have multiple divisions. We have hemat, we have cytology, we have histopathology. Now genetics is also a part of it. So the pros is you will be a consultant. If any of the surgeon has a doubt, you might be able to help them. Actually speaking, you will do very good work regarding the management and deciding the management of it in a team. The biggest con is you are a director, you are not an actor, you are not in the front. So though you have done sizable contribution to the management, the patient will not know. That is one thing which I would say biggest con. That is not just from the student side, it's also from the society side. There'll definitely be one person who is close to you ask, you're a doctor, not seeing patients, why? So that pressure is something which I would say is the biggest, I won't call it a con. It's something which adds an extra pressure to an existing a young doctor who wants to choose the field. Pro is something which has an amazing work-life balance. You contribute to the management. After some point of time, you won't have night duty. And most of the reports for me is not something which has to go immediately. It will take its own time. I can do decent work. There's good scope of research. These are the things which is a pro.
What do you think are the three main reasons people avoid taking pathology? I mean, despite being the fact that it's one of the most critical branches in the field of medicine.
To be frank, the pay scale. That I would say, obviously, that is something which will drive anyone. They feel that, okay, there's not enough pay available in pathology field. Partly true, partly not true. We'll discuss that later in the podcast as well. Second, the lack of patient interaction. You will not have patient interaction by default because you're going to work in a lab. Someone collects the sample, someone takes the blood, you're just going to report under a microscope this. Third, this might not be known to many people. It's a very, very, very academically oriented branch. It's not like I've done PG, I can move out of it. You cannot move out of book at any point of time because WHO changes every organ every 4 years, which means at least every year, 2 organs keep changing. So it's a very academically dependent branch. Unless and until if you're a bookworm, this field is not for you. It's very, very academically heavy. It's more heavy than most of the branches out there. I would say even a little bit heavier than MD General Medicine. It also has updates, but in very few areas. This has updates in almost every area available there. And the other two things is the patient interaction and also the money part makes them a little bit not take pathology as the first choice.
What kind of characters should a student have to actually, be the best fit for pathology as their specialty?
The first thing I would say is the learning curve. Medicine, history taking, examination. Surgery, examination. You must have done sutures. So you don't start with zero. In pathology, that we look outside the slide and diagnose, not into the microscope. So the knowledge of pathology is kind of zero with respect to diagnostic pathology in an MBBS. You might be an amazing student in MBBS, but still you will not be able to even identify an appendix with confidence, normal appendix with confidence. So the learning curve is very slow. So which means don't expect to master the subject within a year or two. You cannot. Even you must have passed the MD, passed DNB, whichever field you are taking. After passing also, you might be required to go back to books at some point of time. Even today, if I diagnose something, if I don't know, I turn the page of the book and I read for half an hour and then come back to it. You have the liberty, plus you should have the will to read it. So that is one major attribute. I would say patience. It requires lots of patience and requires lots of learning and unlearning as well. Something which I learned 5 years back is obsolete now. It's not useful at all now. So learning, unlearning is one main attribute, and extreme amounts of patience is there. And you should also be okay with not seeing patients, because you will be disconnected from the patients. That's how the field is. The field demands you to be behind the microscope, be, like I said, be the director to do it. So you'll have no patient interaction. You should be okay to read a lot, and you should be have a very slow learning curve, which will take years for you to master the art.
That's true. I won't say bias, but that's one of the regular things a pathologist faces.
True.
That you are not seeing patients and you are a non-clinical doctor,
True.
which is absolutely not true.
True.
Boss, you have educated so many people. You have seen people go through MD and DNB. You have yourself seen the whole, life journey. So what would you say is the main difference between MD pathology and DNB pathology? In today's world, do we consider them equivalent, or there is still some bias against one field?
So the difference primarily between MD and DNB is, in MD, you are in a medical college hospital. DNB, you are in a hospital setup. When anytime this conversation happens between MD and DNB, one of the important pain points is pass percentage, because DNB has a less pass percentage. Doesn't mean that the doctors in DNB are inferior. The main difference and the hardcore truth, which many people are not okay to say, it is, in MD, the teacher or the HOD has seen me work for 3 years and I write the exam in the same institute. So even if I don't do well in that day, they know what I have done in the 3 years. So they'll have some amount of soft corner. Okay, this student is a good student, so something fumble has happened. That is possible for everyone in the world. In a DNB, if you, let's say you are doing DNB in XYZ hospital, you don't write the exam there. You write exam in a different center given by the NBA, obviously, right? So that time, they judge you based on that day's work. So if that day is bad, you're unlucky. That's the main difference between DNB and MD, as per my view. Like, there's no other major difference at all. Second, I would say a very good DNB hospital with respect to pathology is actually better than MD. Because pathology is something which is based on machines, the new markers, the new stains. A corporate hospital purchases it first. A government hospital is based on the funds, is based on the hierarchy, is based on the approval. There are many things that will stop them to do it. There are still a few colleges which do age-old techniques. They don't have a flow cytometer. You won't see any corporate hospital without a flow cytometer. A good first tier or a good second tier hospital, you won't see without flow cytometer, right? That's an advantage of a DNB over MD. So coming to the second question, like, is there any difference in real life after you pass? One place there's a stark difference till now. The entry into government or a central institute, they prefer an MD over an DNB. It will change over the period of years because the people who are deciding are MDs. So there's a soft corner, that's all. When that changes, this also will change. Apart from that, work-wise, once you come to work, it's based on 2 rules. Are you good? Are you able to diagnose good? Are you not creating trouble to the hospital? That's all. That decides. MD and DNB does not matter at all at the work level. But yes, there's still some amount of hesitancy in a government college, not in a private college. Entry into government college or a government job or in a central institute, there's still a bit of bias to more favoring towards MD than a DNB.
Thank you for that. Since we're talking about MD and DNB, can you just tell us the top 5 colleges for MD in our country and the top 5 institutes for DNB in our country?
See, when I take top 5 MD colleges, obviously AIIMS Delhi comes. I am a bit biased about PGH Chandigarh. I would say PGH Chandigarh is better than AIIMS. I don't think many of them will agree out there with me, but PGH Chandigarh is an amazing set of teachers. I'm not saying AIIMS does not. AIIMS is AIIMS. It will have lots of influence from outside. It's not that the doctors are bad. You need to do many things. You need to prioritize many things. There'll be lots of conferences happening. There'll be lots of things happening in AIIMS because that's AIIMS. So PGH Chandigarh is a little bit secluded and they have equally amazing teachers, very high caseload and almost every advancement. PGA actually has specialized people for every department. There's a cytology specialist, there's a hematopathology specialist, there's a liver pathologist, there's a kidney pathology specialist, right? PGA is better for me, little bit compared to AIIMS. But if you are aiming to go abroad, AIMS has the brand value any day than a PG Chandigarh in a foreign country. AIMS, PG Chandigarh, JIPMER, CMC is an amazing place. Difficult place to work. Stipend is not that great, but an amazing place to learn. And again, there are easy opportunities to go abroad when you are in CMC because of the Christian missionary and all those links what they have. Then I would say, coming to DNB, there are amazing hospitals in DNB. Like Gangaram is a very good place for DNB Pathology. Most of the Apollo chains are decently good for DNB Pathology. NIMS is good for DNB Pathology. These are few things which comes on top of my mind for DNB and for MD Pathology in our country.
Thank you. Boss, what are the super specialization options for a pathology postgraduate?
Okay, this most of the students, what they ask is, can I do a DM clinical hematology? The answer is yes, because it's one of the feeder branches to do DM clinical hematology as on date. Because I don't know when NB changes the rules, it's not in our hands. So apart from DNB clinical hematology, what we have is we have more than a DM is there in histopath, DM is there in oncopath, DM is there in hematopath, and also neuropathology. NIMHANS gives DM for neuropathology. There are lots of fellowships. Every organ you take in the body, there's a fellowship available. Right from the brain, cytology is a fellowship, liver, GA pathology is a fellowship, pediatric pathology has a fellowship, renal pathology is a fellowship, almost like bone soft tissue is a fellowship. My personal opinion is get into a fellowship rather than a DM, because DM again, 3 years, you are a student. You don't sign individually. You are being watched by someone. The amount of confidence you get after signing the first report will be delayed. You, after doing DM in pathology, you might sign out the first report at 30. That's not when you want to take risk. So after MD, 1 year fellowship, no thesis, you get decent knowledge, come outside, sign. Because when you sign the first report, I still remember my first report. It was simple appendicitis, but I looked at the slide 3-4 times because I am signing below it. That gives the, I am responsible for whatever goes wrong or right. So that is what is going to make you read more, hone your skills more. So I would say do a MD, whatever you feel you want, do a fellowship. That's my opinion. If you want DM, you can do a DM. And then come outside and practice as early as possible, because you have the bullish confidence when you're young. It will automatically be little bit kind of quoted when you become old. That's why I prefer a fellowship over a DM.
Which specialty of pathology, like a subspecialty, do you think will have the highest potential in the next 10 years?
Two things which comes on top of my head is oncopathology, because the amount of attention, the amount of cases which is increasing by default, that will be the one. Second is genetics, because I feel that India is in a phase now where personalized medicine is not a big deal. It will definitely become more. When I say personalized medicine, like let's say my mom is diabetic. She takes metformin. She takes a drug. There are few countries in the world where why should I take a drug which is being researched on some random person and not on my genetics? There are pharmacogenetics available. So I can actually tell you have this syndrome. I take your gene. This drug works best for you using pharmacogenetics and pharmacogenomics, right? So that is personalized medicine. People want shoes to be personalized. Medicine also will be personalized, and those people who want personalized medicine will be the higher paying people.
True.
So by default. So when personalized medicine get into India as a big thing, genetics is going to blow up like anything, because you cannot personalize with any other thing. You can personalize only with your gene. So by default, genetics might not be in the next 5-10 years, might be a little bit later, it will have a boom. But oncopathology now, as well as in the future, it has a boom.
I have heard so many institutes in the country who are basically giving fellowships about oncopathology especially, but they are not MCE or NBE recognized. So do you think there is any worth doing those kind of fellowships?
See, like I said, when you are working in a hospital or a lab, what I am going to look is whether your diagnosis is on spot. It doesn't matter that you are an MD pathologist or a DM. If a DM makes a mistake, not a good thing for an institute. If an MD makes an amazing report, amazing person for an institute. So the recognition part is debatable. But for me, if I have a pathologist with a very sound knowledge and having a fellowship from a non-recognized thing, I don't care. I mean, he is giving an absolutely perfect report as per the guidelines, which helps the surgeon, which helps the medical oncologist. That's what's required at the end of the day. If you have a recognized degree and if you're not able to give that, that doesn't matter at all. Most of the fellowships which are awarded in our country is not recognized much.
Okay.
So primarily, I would say, as an employability mark, this recognition is not actually something which will make a huge or a stark difference. The experience what you get, because there are amazing institutes which give fellowships, but MC is not recognizing, NMC is not recognizing. It's not the institute fault. Like there are institutes which has every day 20 renal biopsies, having fellowship, but not able to get recognition because they are either in private or not coming into the purview of what NMC has its own criteria. But every day 20 renal biopsies, and throughout a year, you would have seen so many renal biopsies, you can diagnose them within jiffy. So for me per se, it's not a big deal or a breaker that, okay, this fellowship is not recognized, this fellowship is recognized. I would say the knowledge what you get out of it is what is more valuable for a hospital, for a patient, than the recognition.
So why I'm asking this question is a dear friend of mine is actually doing the same thing, but from a hospital which is not recognized. Now her apprehension is that she might have to basically invest 1 year, and post that, if a commercial hospital or corporate hospital does not recognize that kind of fellowship, then that 1 year goes completely into waste. Leave apart the knowledge part. All right. And because she has also taken a dip in the salary, because the fellowship is paying less than the normal salary. So there are two parts of this sword. Now, my question too is again, what if tomorrow the corporate hospitalist does not recognize that fellowship? Does that 1 year completely go into waste?
To be very honest, corporates don't even care about it, because I've worked in corporate hospitals. That is my very blunt and honest truth. Quite a few degrees which are done abroad, not from pathology, from any other field, are not recognized in India. Do you even care about it? You must have seen FMNAs, lots of things. Nothing is recognized in India. So for me or for a patient, patient doesn't actually care if it's a recognized degree or not recognized degree. Good doctor, amazing diagnosis, good to talk, makes sense, good for me. So for me, honestly speaking, a corporate hospital at no point of time will say that go and see that it's not recognized degree, so I'll push you down the ladder. Good skills, they'll definitely take your part. Because at the end of the day, you have MD, which is recognized. As per the NMC, when you have an MD pathology, you are allowed and recognized to report any organ in my body. So that is enough for me. So legal standpoint time, I am able to report, be it CNS or kidney or liver. The fellowship primarily is to hone the knowledge. Okay, I've not seen good amount of CNS cases. So let me go to NIMHANS and have a tiny fellowship or an observership. So it makes my skill much more better. Because MD is given me the license to report everything. So if I have that license and if I have a better skill, I don't think so corporate hospital will worry much about that.
I understand. See, but as a student point of view, everybody is investing 1 year of their life, taking half the salary, so that after that particular fellowship, when they stand in the line of, getting employment, they are the chosen one. And the corporate hospital or anybody should look at, okay, this person is special because he or she has something extra which the other people do not. Now, my question again is that if they do it from a non-recognized hospital, will that fellowship add to that particular aspect? Will they become the chosen one in the line of 10 people?
Like I said, there will be no difference primarily, because let's say that you're doing from a non-recognized hospital fellowship. Ultimately, what a corporate is going to do is look at a CV. Publish amazing articles. Because fellowship, you are there for 1 year or 18 months. Most of the fellowship is 18 months. 18 months, you contribute to amazing journals outside, Lancet or very big journals. That speaks the volume of work what you have done. So every hospital is based on the work. I think India as a country has moved away from looking at the degree. We are looking at what this person or that person is going to help me, productivity and the work quality. That time, publishing articles will definitely make your CV better. You will actually be the chosen one than a person who's not published the article. So the 18 months or 12 months fellowship, whatever you have from any place, if you get recognized, that's preferred because it's a safe bet. If you don't get the recognized place, but you get an amazing institute with non-recognized seat, make your CV better there, learn more, let the CV speak for you, so you become the chosen one compared to the other person. That's all.
Boss, what are the potential of this branch outside India? What are the job opportunities abroad? Okay,
see, outside India, I would want to talk about two things. One is US and a European degree. European degree is acceptable in almost everything. So FRC path is something, FRC path when you go, there's FRC histopath, FRC heme path, and genetics and microbiology is a different thing. So FRC hematopath primarily is more of a clinical degree. So once you complete FRC hematopath, you can do the work of a DM clinical hematologist. You can actually treat patients. That's what FRC heme path does primarily. Pathologist with a 3-year experience into hematology is eligible for that. FRC histopathology, which is something which is recognized in the Europe, which is recognized in the Middle East, which is recognized in European nations. US doesn't recognize it because US is US. They don't recognize any other degree. Histopath has two things: first step and second step. First step is an MCQ exam. Even in India, you can write it. It has 2 sessions, winter and spring session, 2 sessions. Second step, you have to go to the Royal College. They will have a 1-day program which will include a little bit of clinical examination, because their pathology is not separately lab, because they go for rounds with the clinician. So if it's an skin lesion, you have to examine them first, not very much in detail like a dermatologist, but you have to see and write down the points. Then you have to diagnose things. The difference in FRC histopath and Indian reporting is it has to be structured. They have a template. I have to go with the template only. It's not a very difficult exam to clear. If you start reporting as per the template during SRship, most of the hospitals report as per template. That becomes a bit easy. FRC step 1 is, it's like PLAB. PLAB has an extremely high pass rate. It also has an extremely high pass rate. It's just an MCQ exam with a fair enough knowledge of MD pathology, what you gain. You can easily clear that. Next is US. US, the right path to go inside is same route. They don't consider your MD as a degree. If you finish MD also, you have to clear USMD step 1, step 2, CKCS, then go create a CV and get admitted there. Only one advantage is, if you have completed MD and you apply to a college, you might get placed in the best college like Boston, because those are colleges which is not easy to get into if you have an MBBS degree. That will have an added advantage, but that's a long journey. You have to redo the entire thing again. If you want to settle in US for personal or professional relations, US is a very good place to settle. And US pathology degree is a bit difficult to get for an IMG unless and until you have an MD or a 3-year work experience done. That's demanding, but I would say if you want to go to Gulf, go to the UK path. If you want to settle primarily in US, go to US only, but it's a very long route. FRC path is a bit easy to go, easy to crack compared to US and US only.
Thank you so much for a detailed answer, boss. Really helps. All right. I have not got a better answer for an abroad situation till now. So thank you so much for that. What are the opportunities in the corporate and government sector in India for pathologists?
Government setup, I can fairly say it's a bit difficult to enter. Primary reason, government is not expanding as much as it should, or is not giving jobs as much as the pass out comes into play. But AIIMS, since it's opening rampantly, I have like 3 or 4 my juniors and 2 seniors of mine in new AIIMS. So if you are a pass out now, there might be an opportunity to get into AIIMS. That's a settled job. Like you not care about anything till your retirement. You're going to be there, right? Government colleges, government jobs, otherwise it's a bit difficult to enter. You have to look out for the various openings available. UPSC CMS is a route to enter, because if you get UPSC CMS after MBBS and you complete an MD, you get into a specialized posting. That's a route to enter in central government says. Or state governments, you have to look for it. If whenever they apply in thing, you'll have huge competition, because it's a permanent job. You'll definitely have huge competition. It's a bit closed, I would say, as of now. Coming to private, there are multiple modalities. One, you can work in a medical college. Medical college, biggest problem will be it will not be close to your home, because every private medical college is somewhere in the middle of outside the city limit most of the time. And pathology is something in a private medical college, I say it's bit kind of full as compared to the other paraclinical and preclinical subjects. Then labs. Labs, there are corporate chains of labs where you can go as a consultant pathologist. There are tiny labs which will require your time for part-time in the evening for 2 hours, 3 hours. That's also possible. You can go for 3-4 labs like that, or you can settle in a corporate lab which takes your time from maybe morning 10 a.m. until evening 5 p.m. or 6 p.m. Then hospitals. So hospitals is a teamwork, because you will not be the only pathologist in the hospital, because a hospital with a 300-400 bed, one pathologist cannot take care of it. So you will enter as a junior consultant, you stay there, you learn how to do it, you have a multidisciplinary approach team. Most of the corporate hospitals now are multidisciplinary. They are not like, I'm a different department, you're a different department. They consult together on difficult cases. Easy cases, obviously they take their own call. If you're a young pathologist, my first thing will be go into a hospital setup where you'll have the guidance of a senior, because you're very young. Learn a little bit there, then maybe branch out in the evenings for part-time. Because when you go initially to a completely new corporate chain, there'll be a cultural shock because there'll be lots of things which you must have not seen in your MD or DNB. So that will be buffered if you go into a hospital, then move out. That is my take, but there are multiple examples of my juniors who have shined very well right outside my MD going into a corporate chain. But it's again based on your skill set. But this is an easier path, more comfortable path, and more buffered path than directly going to corporate chain.
Just moving a little bit, from the normal chain of questions, what would your advice be? Should a MD pathology also do DNB after the MD? Is
See,
it preferred, or should they directly go for some fellowships?
This is a personal choice. Quite a few of my colleagues did that. I'm a person, like I said in the start also, I am not being degree. Skill talks at a long term. Skill is the only thing which matters. Degree is something which helps me to reach the place. MD DNB looks good on paper. Okay, this person has completed MD and DNB. But it does not add any value. Look, okay, this person has MD DNB will get more salary as opposed to only MD or only DNB. It doesn't matter. For me, at the end of the day, if I run a lab, I would say, okay, this person does a good job. I'm not going to look at his name, tag, or what degree they have behind the name, right? That's how most of the hospitals work. People do MD DNB because primarily doctors are more academicians. They take pride in having multiple degrees. And when I grow up also, I see a doctor name and degree bigger than the doctor name. I like the person has studied so much. That might be something which is back in the back of my head, which pushes people to write DNB exam after MD. Otherwise, I don't see any added advantage in work profile for MD DNB versus only MD alone.
Thank you. That's a very honest answer. I really like that. I appreciate that. So, boss, let's talk about labs. I think being a pathologist, the fanciest thing that students, normally tend to think of is that one day they will be able to open a lab. Now, the problem is that nobody gives us a clarity how and how much will it take to actually open a lab. How do you define the least possible size of the lab? How much it can grow? We have seen the big diagnostic centers like Saral, etc. And we have seen the magnitude of that. But everything started with a single cell.
True.
That's the reality. Now, my question to you is that if a new pathologist basically wants to open a lab, what is the minimum requirement to open the lab, the size, the kind of infrastructure, the machines, and what is the minimum capital required to open a lab?
This answer will be very important because I feel that India is in a place where it's moving more towards entrepreneurship than going behind jobs. I feel youngsters will be more into entrepreneurship and ventures than going behind an employed thing. The first and the foremost thing, if you want to open a lab, the mindset should be of a founder or an entrepreneur. Because unfortunately, our MBBS curriculum didn't include finances. It should have included.
Yeah, true.
It talks about medicine. It doesn't talk about healthcare economics. That's a totally different thing. I had a lab. I burnt my finger. So I learned by doing it. So when you come to labs, primarily I would say that any young person who's going to start, first they should have a different attitude as opposed to just a doctor. As a doctor, I read, I diagnose, I come outside. So you should have a mindset of an entrepreneur. You should have the mindset of, you should be ready to be working more than the work hours. Coming to numbers, a small lab, it's based on again which part of the country you are. First tier, second tier, third tier city. Let me talk about second and third tier city because first tier there is lots of inflated real estate and everything. So in a second tier and third tier city, you need a minimum of 300-400 square feet place, a proper partition one, get an help from a designer to properly divide them. When you open a lab, it's not going to be pathology lab alone. You have to do biochemistry because biochemistry is more bread and butter than histopathology or cytology and hematology. So it includes biochemistry, normal RFT, LFT, those machines, and your hematology. So there are two ways here. One, I can get a machine for reagent rental. So which means they will give the machine. They will say that this is the minimum amount of tests you have to do. And the cost of the reagents will be higher than when you purchase your own thing. Starting, I would say go with that. So that you don't put a dead investment of 10 lakhs into a machine when you can use it for marketing and other activity and knowing it. Get a reagent rental, so you won't have any overheads. You have to complete 100 or 500 tests per month. So go with that, which means building of the lab and the interiors based on what your thing is, as simple or as fancy you want. The location and the rent, I would feel in a decent second tier city, 20-25,000, you should get a decent place. Start that. Go with reagent rental. Don't buy anything as such. A minimum investment of 5-10 lakhs should be enough for you to start with. So to grow, it's based on how much you are vested into it, how much you are able to go and talk to a clinician, how much you're able to convince or make a connect in your circle. Okay, I am a good lab. I can give a very validated reports. Please send to me. That's a skill which you learn on the go. Or if you are coming from an entrepreneur family, it will be imbibed for you. Otherwise, it's a learn on the go. 5 to 10 lakhs should be a decent investment to start with from zero. Please don't buy any instruments because they're very dead investment. And instruments these days, a simple CBC analyzer costs you somewhere in 15 lakh rupees, a very good one. Why to waste that when I can get on a reagent rental? Get on a reagent rental, start the thing, please work on increasing the patient's inflow, the sample inflow. Be okay to take suggestions. Go do home collections because these are the things which can initially increase the revenue of you, especially in a second and third tier city.
What are the minimum amount of machines required when we open a lab?
Okay. One is your CBC analyzer, which does the platelet and everything, all the CBC things. One, a simple biochemistry thing. We have two things in biochemistry, serological and immunoassays. So serological thing is the basic thing required, which does RFT, LFT, creatinine, all those things. Immunoassays are the one which does the tumor markers, which does enzymes, those things. Again, those are also available on reagent rental. These things will cover close to 70-80% of all the tests. After that, you have urine tests. Those are dipsticks. These are disposables. Take dipstick and throw it. And cytology, you don't want anything. You just need a slide, a syringe, and few stains. Those stains will be a couple of hundreds, that's all. So it's based on the cases. More case you do, you have. Histopathology requires an investment. Because histopathology per se, there's something called grossing station, which is a bit expensive. And that doesn't come on a reagent rental. You have to purchase it. And then you need machines to cut, machines to create the block, place to store. Those things might require a little bit of bigger investment compared to hematology and biochemistry. Start with hemat, biochemistry, cyto. Once you have sufficient amount of inflow, go and venture into histopath.
What about the phase 2? Let's suppose if we start histopath, how much investment is required and what all machines are necessary to basically grow that lab?
Okay. So coming to histopath, when you're starting, there are branded things like Leica. It's an amazing, Roche, it's an amazing brand. There's no doubt in that. Superb sturdy machines, but they come with a price tag. It's same like an Indian made versus foreign made. When you're starting, if you have enough time, please go and talk to other fellow entrepreneurs, do a research, which Indian brand is sustainable. Get that. If they are good enough creating good product, that's enough for me. I would need a tissue station, grossing station, which can start with a simple sink and a table at the start. Later on, you can develop it. So just a table, sink, and a proper instruments, a scalpel or a knife is required. Those are very, very tiny investments. Then I have tissue processor. Tissue processor starts with 2-3 lakh rupees. And then I have a microtome. Microtome is the cutting thing. Microtome will start again at 2 to 3 lakh rupees. So for me to set a very basic histopath lab will require maybe somewhere in the ballpark of 6-7 lakhs. Very basic, not going with branded at all. Branded goes in double digits. Almost everything in branded goes in double digit. Get it when your workload is more, because that is justifiable as well. Why to invest so much of money when the workload is less? Start with a tiny thing. You can do manual processing also if possible. If you have the time and energy, do manual processing also. Otherwise, go with a tissue processor which is automated. That is going to 6-7 lakhs extra. Why? Though the investment of hemat and histopath is same. The reason why I'm saying do it later is you don't get biopsies as quickly as you take blood test. If a person walks to a clinic, maybe 10 people, I may do 5 people blood test. Only when 100 people comes, you get a biopsy. So the amount of investment and the return is a little bit less in the early half of the histopath lab. But later off, if you want to go, you can go as early as 6 lakhs, or there are instruments which is as high as 1 crore. So it's based on what you want to do. If you want completely automated, those are going to come with a big price tag, and big names, big machines, and everything. This is going to definitely come with a big price tags.
So I'm going to be very blunt and ask you, what is the normal commission model with the doctors, the consultants who are sending the patients?
Okay, since it's for the young students who's going to build up things in future, I'll be very open truth about it. When I started my own lab, I had a cultural shock coming from a government UG and a government PG college. I said, okay, I have a degree. People will send me samples. That was the biggest misjudgment ever in my life. So the commission starts from 20%. It goes high up to 60%. Sometimes there are few doctors who I went and asked. The first thing they asked was not the credibility at all. How much will you give me? It'll be blunt answer. See, you should be okay with it because you're doing a business. You are an entrepreneur, you're having a lab, you should be okay with it. For me, like I said, it's a cultural shock. I didn't expect that. I have seen that in movies. I thought, okay, doctors are a noble profession. It's not happening. It won't happen like that. But that's a reality. It starts from as low as 20%. 20% is like bare minimum and goes as high up 60%. Again, this based on the volume of tests they give. If you are in a place, you can create that model. Like let's say you send 20 cases for me in a week, I'll give you this much. If you send me 100 cases for me in a week, I'll give you this much. But this is the ballpark, 20 to 60%, irrespective of what test it is. It's based on volumes. This is something which will definitely kill the dream of an entrepreneur, because 60% going out of a 100 rupee test, 60 rupees is
I am happy that you're saying this, because it should not come as a cultural shock.
It should not.
All right. When the audience actually thinks about opening a lab, they should keep this cost as a fixed cost when they're making the budget in itself.
True.
And it's very important.
True.
There are so many things when I started working in the business that I took it for granted that this will not happen. And when it happens, it demotivates you a lot.
True.
But now when I'm entering different businesses, I know that this is the reality. This is going to happen. When I do something, these people will come, that people will come. I know I have to shell out. So it actually makes you confident that, okay, we are not new in the world.
It makes you prepared for what's the ground reality. And
Exactly.
you have to be prepared, because see, I'm having a 100 rupee test. My cost of the reagents is fixed. Infrastructure is fixed. That'll hardly cost you, let's say, 10-15%. That's all. So worst case scenario, 60% goes. So what I'll have as an EBITDA is going to be somewhere around 25%. So 25 rupees for 100 rupee test. This is the ground reality. If you want to grow big, that's how it happens.
A serious question comes here. When we were going through the research for the podcast, we saw that over 1 lakh labs are there in our country. Yet only 2% are actually NABL accredited. Now my question to you, that in so many labs, the magnitude is so high, the volume is so high, how will a small or mid-sized lab actually survive?
See, for this question, there are two things you want to say. One is the immediate or the least amount of time you can take to give a report. Because if you have a corporate lab or a big lab chain, the lab will be in one place. So there'll be collection centers. From there they send it to the lab. There might be a delay. But if you are a new person, if you are young and in that place, you can tell to the doctor, see, sir or ma'am, I can give you the report in 2 hours, which a corporate chain cannot do. It will take minimum out of one day minimum. That's where I can have an added advantage. Second thing is, when you're young, when you're new, if someone says that I'll send you 100 cases, but I want 60-70% commission, at the start, be okay with it. Because that will make your reagent rental model working. Because the inflow will be there. You can reduce, if this inflow comes, you can talk to the reagent guy and say I'm buying more reagents, reduce money there. So everything is a volume business at the end of the day. So be okay with that. Build the rapport, build the quickness, build the trust. Maybe later on, you can go and sit and to the doctor and say, you've been doing for so much, so this is a bit difficult for me. Let's renegotiate it. At that point of time, once trust and commitment is built, the doctor might not double think. Because initially for them to ask more is, you are new. So once the trust is built, I think that also will slowly over the period of time come to a level where both of them, it's comfortable for both of them.
I absolutely second that, and I can add, guys, that this is very important. Wherever you are starting a new business, the negotiation should never be at the first point. The first point should always be building a rapport and starting the volume. Once the work is started, once that ball gets rolling, that's where your business also starts. All right, you can very well renegotiate after 6 months or in a year, because at that time there is a trust, there is a rapport, and everybody wants to work with a trusted, committed person. That level of trust and commitment is the highest thing that you can ever earn. Once you have that, people are more than willing to negotiate with you, renegotiate, and come to a comfort level. But that 1 year is the point where an entrepreneur or business owner needs to put his struggles and needs to put his head down and just keep working. After 1 year, everything changes. That's a promise.
True.
So, boss, now we come to the most demanded question of our podcast, and which is, how much does an MD Pathology or DNB Pathology can earn in our country? As an SR, as a pathologist, 10 years in his career, 20 years in his career. Government and corporate.
So we'll divide into three categories. In a medical college hospital, you enter into a private medical college as SR, you get somewhere paid between 80,000 to a lakh per month. As an associate, you get somewhere around 1.25 lakhs per month. As a professor, 1.7, 1.8, and it can increase up to 2.5 based on HODs and administrative things. As a pathologist per se, working in a private hospital as an employee, you get a same starting salary, somewhere around 75 to 80 to 1 lakh a month. 5 years down the road, you might get 2 to 2.5 lakh a month. 10 years or 20 years down the road, it'll have a ceiling limit of 3. More than 3, it's a bit difficult. You can earn more if you work in a different hospital, 2 or 3 jobs parallelly. When you're in an administrative setup, like you are a head of a lab or you're zonal head of a big corporate chain, that earnings is going to be different because you do a job of doctor as well as you do job of an administrator. You cannot start as a lab head. You need a little bit of experience, maybe 5 years experience into a lab, and you become a lab head or a district head or a state head. You might have a CTC of around 30 lakhs to 36 lakhs per year. And then you go into a zonal head, you might have a CTC of around 50-60 lakhs per year. And you go into national head, you might have north of 80 lakhs per year.
Thank you so much, boss. Very concise, very educative. Now we actually will move on to the questions that have been asked by our friends on Instagram and YouTube.
Sure.
All right. So I'll ask you very direct questions. Okay. Just be super spontaneous with us. What are the opportunities abroad, including the competitiveness of FRCP path? Is it worth preparing for?
FRCP path is worth preparing if you're going to stay abroad and work abroad. If you finish that and come back in India, it's not worth preparing.
After completing MD or DNB in pathology, should one choose a DM super specialty or a fellowship course?
My preference will be a fellowship course. As early as you come outside and report, more better you are.
What are the factors influencing the choice between DM and fellowships?
The time duration, the thesis there, and you get stuck as a student for extra 2 years rather than a consultant. The 2 years values more.
Do you think that there is a better job opportunity when you have done DM instead of a fellowship?
Maybe the top tier hospitals or the top tier academic institutions might prefer, but the majority of them don't.
And let's suppose when you are open for a lab head or the head of the department, don't you think they will prefer DM over?
I would prefer an MD because MD knows everything. DM is more narrow and focused.
Can a first generation doctor from a lower middle class background pursue pathology? What about the income aspect? I think income aspect we have already
discussed
covered.
it.
What's the first answer for the first part?
If you're okay with not having much of a patient interaction, and if you're okay to learn and slow growth curve, definitely you can choose it.
What does the future of pathology look like in the next 10 years?
When the evidence-based medicine is going to go to the nook and corner of the country, the evidence comes from the lab, radiology and pathology. So there's definitely a huge amount of opportunity there in lies with pathology or any lab medicine for that matter. But when insurance when it comes in, this again becomes better. India is going in that path. So I feel that in the coming years, the importance of pathology and a good report signed by a competent authority will definitely have more value than any time in the past.
What's the role of AI in the pathology in next 10 years?
See, coming to AI, I have worked in few of the startups in AI from US where I have annotated primarily few things for the machine. AI in pathology the growth is a little bit slow, but I am really not sure, or I don't want to commit that it will not do any major changes because it's growing at a tremendous rate. I don't know what happens in future. But one thing I can say for sure, AI will not replace doctors' jobs. The doctors who know AI and the doctors who can leverage AI will reduce the opportunity for doctors.
True.
That's all.
That's a very good answer.
So AI is not going to take job. Let's say I am reporting today 20 smears in an hour. I know AI. I can implement that in my lab. I can report that in 5 minutes. So I will change it if I know it. So I'd say for a young generation doctor, any field you are, please stay advanced. If you want to be in the top 1% or 2% earning category, you have to stay advanced. You have to know it because doctors who are very well versed in AI, there's a very likelihood chance they might eat the opportunities of other people or shrink the job opportunities as it is available for now.
How much experience is needed to join as a pathologist in a highly professional hospital like JIPMER?
See, JIPMER has a very basic thing. You finish your MD, you do a 3 years of SRship, you are eligible to join into JIPMER or AIMS or any central institute for the matter. They need 3 years of SRship, that's all. And to entering it, you need a very strong profile, CV. If you are an alumni of a central institute, they prefer you. compared to a person who's coming from outside. But 3 years post MD is the minimum thing required to enter as an AP post in any of the central institutes.
Which is a better choice? MD Pathology from a peripheral government institute or DNB from a good government institute?
DME from a top tier institute is any day better than an MD from a peripheral institute.
Thank you so much, boss. I mean, you have very honest and very, realist answers, which I really like. So now let's move to the rapid fire because
Okay.
there we are going to check how much truth you actually tell us.
Okay.
So very simple, 2 rules: super spontaneous and super truthful.
Sure.
All right. So if you could visit any place in the world, where would it be?
I'm not much of a travel buff. I would prefer my room and my family members to be around me. Wherever it is, whichever part of the world it is, if I am with the family, I enjoy that.
What's your dream job if money wasn't an issue?
I like cooking. I would definitely want to become a chef. That was my primary intention even before taking a doctor. But life has its own way. It moved this way.
You're an entrepreneur yourself. Boss has created lots of businesses, apps, and everything. What do you think if you had to create a business for next 10 years? What would that business be?
Upskilling, because that's where I feel the thing is. It's now degree is not enough because degree is not making people employable. So what gives me the skill so that I can make people fit for a job at any sector, whatever sector it is? I'm just going to make them a person who can go and sit in a job. Like I said, after 10th, you have the skill. You are ready to be employable. People will come and take you away. I feel upskilling is something which I might blow up, I think. And
I second that.
integration with AI in healthcare has huge money involved, but I don't know its applicabilities yet. But future will definitely change its course.
Describe yourself in one line.
I'm practical. I'm a bit lazy, and I love family than anything else. And I love to learn new things and stay updated as much as I can.
What's your favorite sport to watch or play?
I like cricket. I like to watch cricket. I play cricket, and I like to play basketball. Though I'm not a fan of following basketball, but I like to play basketball. If it's indoor, I like chess.
What's the last movie you watched?
I watched a Tamil movie called Vidudalai Part 2.
Okay. Happiest moment in life?
Happiest moment in life. There are many happy moments in life. But for me, the biggest moment is I got a place for my parents to stay in their name. That is something which is best for me.
Great. Thank you so much, Dr. Ranjith, for being a very practical podcast guest today. I mean, I can very well say that it was a very realist conversation we had. There was no, the answers we tend to hear, but the realist answer and the ground level knowledge that you have parted with us, I think it's super helpful.
Thanks
And
a
I
lot.
can say on behalf of all the audience, thank you very much for actually telling us what reality looks like.
Thanks a lot for having me here, and all the very best for future generation doctors. I say with a little bit of selfishness because you have to become great, because when I become old, you'll be treating me. Thank you, guys.
So thank you so much, everyone. I believe that it was a very wonderful podcast today. Lovely guest, lovely conversation. And I hope that I have covered all the questions that were asked in the Instagram and YouTube chat section. I believe the questions that were left out, we have covered in the main questions itself. So thank you so much, everyone. And who do you want the next guest to be? Please put the name in the comment section. And as always, you can very well help me. Please message them to be a guest on the Nachiket Bhatia Show. With this, we come to our end. Thank you so much. Do not forget to subscribe. Subscribe करोगे तो और अच्छे guest लेकर आऊंगा. पक्का promise. Thank you so much. God bless you and best of luck.
Bye-bye.